Uh, Len Bruce, Acting Executive Director of Medical Services, Murrumbidgee Local Health District.
Good. Wonderful. An
Oh.
update.
So good morning everyone. Thanks for coming, and there's good news today is that there's still been no new cases of COVID-19 disease in the Murrumbidgee Local Health District, so the number is still at 42 people who've tested positive. And as of today, 13 of those patients have completely recovered. And as you're aware, we did have the sad event where a patient passed away, but luckily there's not been any new fatalities related to COVID-19 disease in the Murrumbidgee Local Health District since we spoke last week. Now, up to date, we've done 2,318 tests, which is getting up to one test for every 100 patients or persons in the Murrumbidgee Local Health District. But we are concerned that the number of tests are actually decreasing. So we really want to encourage the community that if you have any symptoms like fever, coughing, sore throat, general fatigue or just muscle ache or shortness of breath, is that you call our COVID hotline and arrange to have a test done. Because the way that you're going to keep yourself, your family and the rest of the community safe is by having a test done, so that if you do have COVID-19 disease, we can make sure that you isolate appropriately, and more importantly, that we can care for you. Because we do know that sometimes there are people who have very mild disease in the initial part of the illness, but then become unwell at day 6 to 10. And it really is important that we can admit you to our virtual service and we can check up on you every day. And should you require any further medical care, that we can provide that to you. I think it really is important that people can be tested now. So there is no shortage of the testing capability. So if you have a flu-like illness, please come and be tested. Because that's the way that you're going to keep yourself and the rest of the community safe. It is more dangerous for people not to be tested and infecting the rest of the community than actually having a test. So that's really important, and we do ask the community that they contact the COVID hotline if they have any of those symptoms.
So what you're saying is that you think there are more cases out there that people are just not avoiding the testing and hoping that they don't have it?
Yeah, it's very difficult to say that. I would assume there are some cases out there, but a number is really difficult. And once again, the problem with COVID disease is that 80% of people have very mild symptoms, and really some people have extremely mild symptoms that you wouldn't think anything of it. But the problem is that group can actually transmit the virus to vulnerable people who will get very unwell. And that's the concern.
And I suppose Easter weekend is coming. There's a lot of regulations on not travelling, staying home. How crucial is the next 4 days?
Yeah, well, the Prime Minister is absolutely correct. If we do not follow the social distancing, we will undo all the good work that we've done in the last 2, 3, 4 weeks. We know that it's an imposition on families. I have 3 small kids at home, and my wife is a GP, so she works, does homeschooling. It's tough, but we need to stick together to make sure that we can protect lives in Australia and protect our families and the community. So really, please stay at home. It's not easy, but it's required.
Bruce, can you just clarify, the media release that came out this morning said there was 12 people that had recovered, but you've just mentioned there's 13?
Okay, well, it could be that I've just checked, so it could be between 12 and 13. The one thing is that about a third of the patients that we've treated have recovered.
Yep.
And remember, it is obviously just the normal duration of the illness is about 2 weeks. So it really is just when people were tested positive, and they will essentially recover over time.
So is that how you're clarifying people who have recovered, like after it's been 2 weeks since?
No, so what we do from the Murrumbidgee Local Health District is that we actually use laboratory testing to clear patients, and the reason why we can do it is because we have very small numbers. So the procedure that we follow in the MLHD is that 48 after a patient has had their last symptoms, they will have a COVID swab done. If that swab is negative, we'll wait 24 hours and do another one. So what we need is that we need 2 negative swabs 48 hours or 24 hours apart, 48 hours after you've had your last symptoms. And as I say, the reason why we can do it is because our numbers are very small, but it's also to be precise.
Any other questions? I'm happy, thank you.
All right, thank you very much. Short and sweet.